I think most everybody is back. We'll go ahead and resume and get started. And I believe, if not mistaken, this is our last session for today. And it's one that we're all grappling with. But we want to focus on it, particularly as it relates to Indian country. Without further ado, I want to describe our next session, which of course is climate and health in Indian country. The increasing magnitude and frequency of extreme weather events continue to threaten the livelihoods and economies of indigenous people and native communities, leaving them particularly vulnerable to the associated health effects. Building adaptive community and resilience to address these impacts are more important today than ever. Today's presenters will discuss CDC's Climate Ready Tribes Initiative and other programs, projects, and tools available to help mitigate the impact of extreme weather events and provide examples of activities and initiatives that tribes have under or implemented to address climate change. So today we have two special presenters, our very own Brett Weber from the National Indian Health Board. As Brett announced and introduced himself today, he is the Director of Environmental Health at Arizona. He is the Director of the Environmental Health at the National Indian Health Board. And then we'll also hear from Jennifer Bosford. Hopefully I'm saying that name correctly. Jennifer, you can reintroduce your last name if I'm saying that incorrectly. And Jennifer is the Bureau Chief of the Environmental Health at Arizona Department of Health Services. So without further ado, Brett.
Great, thank you so much, Sharonda. So, I think that's a laser pointer. So go ahead to the next slide, please. So just touching back briefly on our previous session. I don't know if any of you saw the announcement, but today President Biden is in Arizona and he designated the Grand Canyon National Monument. It's the 5th national monument that he's designated under the Antiquities Act. And it relates to mining because of that, about 900,000 acres around the Grand Canyon will never again be allowed uranium mining. So that is certainly a development that is relevant to our discussion today. I want to talk to you about the Climate Ready Tribes Initiative, which NIHB works on thanks to our partners at CDC. You'll see some of my slides today are based from my friend Paul Schramm's work at CDC, and he and I do the Climate Ready Tribes Initiative together. He at CDC, me of course at NIHB. As we all know, environmental health challenges in Indian country are pervasive. There's a chronic underfunding of the Indian health system, IHS. There's in the Southwest, we see less access to clean running water. In places like Alaska, sanitation facilities are limited, and a disproportionate number of Superfund sites are located on and near tribal land, particularly in the Pacific Northwest. But one thing that's kind of pervasive throughout tribes is, of course, climate health, because we all share the same planet, and climate change and global warming is impacting all tribes, although not all tribes are equally impacted and not all communities are equally impacted. It is touching all of our lives. Go ahead to the next slide, please. So you can see here, this is, again, one of my friend Paul Schramm's slides and the impact of climate change on human health. At the middle there, you have changes in climate that result in rising temperatures, more extreme weather events like the extreme heat that most of the country is engulfed in right now, rising sea levels, and increased carbon presence in the atmosphere. And that leads to a second layer of events like extreme heat, air pollution, water quality impacts, and then that creates the effects on human health, like an increase in asthma, heat-related illness, and then broader socio-political things like migration and civil conflicts. Go ahead to the next slide. So there's several things that should be noted for the importance of climate and health, that environmental justice communities, which include tribal nations and marginalized communities in the United States and worldwide, are often the hardest hit. I think something like 80% of Earth's biodiversity is located on indigenous lands. And those are the frontline communities that are impacted by climate change's impacts. And President Biden is someone who is working to take climate change pretty seriously. I think we can all see that. And his administration is taking a quote, all of government approach. So our friends at CDC have a role to play in climate change. Our friends at EPA, our friends at IHS, the entire federal government has a role to play here. And Secretary Becerra at the Department of Health and Human Services is quoted as saying the climate crisis is here and his department is rising to meet the challenge. Next slide. So CDC operates what's called the Climate Ready Initiative. And there are climate ready states, climate ready cities, climate ready territories, and then climate ready tribes, which National Indian Health Board works on. You can see a map of the funded areas for the Climate Ready Initiative, including several tribes on this map. And we are always happy, like Shay said earlier, right? Whenever we talk about states, we always need to say and tribes at the very least. Go ahead to the next slide. CDC has a framework for climate and health adaptation called BRACE. Again, this is from my friend Paul Schramm's body of work. But BRACE works on a 5-step process on anticipation, projecting, assessing, developing an action plan, and then evaluating that plan during its implementation. And it may be worth taking a moment to pause and look at this slide because BRACE is a really impactful model. It's very comprehensive. And as we'll see soon, it's very relevant to tribal communities, particularly one tribe that I will talk about in a little bit. Go ahead to the next slide. CDC does have some resources. I know this link is probably not super helpful for those of you in the room, but if you are looking at this online or if you're looking at a recording and have the slides in front of you, you can go ahead and click that link and there will be plenty of CDC resources on climate health available for you. Next slide. So I want to talk a little bit about the Climate Ready Tribes background. And I have 2 pictures here. One is of melting tundra, which I think, or excuse me, melting sea ice, which I think is pretty self-explanatory, but the other is mosquitoes. And I put this on here because we don't think about sometimes all of the impacts that climate change can have on a tribal community. I was talking with a tribe in Utah, and they need to set up a mosquito abatement program, and they have never had to do that before because it is so much warmer. There's more moisture, and mosquitoes are breeding in areas that they have not been historically. Now, I am from Louisiana. I am well accustomed to the fog trucks going up and down the street spraying mosquito poison. And so this tribe had questions about how to implement a mosquito abatement program that is, still safe for humans. And so standing that up is not something that I would say, oh yeah, the planet's warming. Of course, people are going to need mosquito abatement now, right? It's kind of a secondary or tertiary kind of impact, but it's something that is real, it's present, and people tribes need support in implementing those programs. So Climate Ready Tribes has really taken a very comprehensive approach to this. As you can see, tribes are often leading the way in adaptation work, and they use traditional knowledge and novel approaches. And Climate Ready Tribes has given them the flexibility to really try those approaches out and use what's successful and elevate it so that other tribes can replicate their success. Go ahead to the next slide. So a little bit of the bread and butter of Climate Ready Tribes. It's, like I said, a partnership with CDC and NIHB going back all the way to 2016. And as Mr. Ritter said earlier today, capacity and retention of project staff working on environmental health is a huge challenge. So Climate Ready Tribes works to build capacity at the tribal level with the tribal workforce, and then also build capacity for climate and health adaptation. There's an increase in collaboration and data sharing among tribes, the US government, and our other partners who can include state governments and other entities, as Dr. Welch said earlier. And then again, increasing communication and information sharing about the health impacts of climate change. And that's more community oriented, right? We don't expect people who are putting their 3 kids through school and working 2 jobs to be able to recite a whole bunch of climate change statistics. But we can say, hey, you know, when you go outside, it used to kind of be optional to wear sunscreen. Now it's really not optional. You have to do it. It's, you know, so things like that around community health. And then also Climate Ready Tribes also provides resources and technical assistance. We have funded 10 tribes since 2016, and we are announcing, oh, actually, I'm getting ahead of myself because that's on the next slide. Yeah, so you can go again, the link isn't necessarily going to be super helpful if you're sitting here in the room, but if you're watching a recording or online, you can click the link and it'll bring you to our Climate Ready Tribes resource page. That includes a number of webinars that we've done over the years and fact sheets, as well as resources from tribes, again, that have worked on climate health and are elevating their work for other tribes to replicate. You can also sign up for our learning community, which again is a series of webinars that we do throughout the year. I want to also mention that for the next year, 2023 to 2024 cohort, there is a request for applications coming out later this month. We will be awarding up to 6 tribes $20,000 to develop community-driven tribal hazard mitigation plans. And those are plans that a tribe uses, and cities and counties have them as well. They are plans that basically detail what the community or the tribe is going to do in the event of a community hazard. So, and again, from Louisiana, our thing is hurricanes. Every parish in Louisiana has a hurricane evacuation plan, so the government knows, okay, there's a hurricane coming. This community is going to evacuate here. That community is going to evacuate here. We're going to have these shelters open. We're going to prioritize, you know, when the electricity goes out, we're going to prioritize repairing it on these areas. Similar things happen throughout the country. And so not every tribe has a hazard mitigation plan in place. In Alaska, actually fewer than half of the tribes do. So the goal is for tribes to be able to develop these plans, implement them, and actually file them with the Federal Emergency Management Administration, FEMA, so that when a hazard comes along, they have a plan in place that they can execute. Go ahead to the next slide. So this is a map, we saw earlier a map of the Climate Ready Initiative. This is just Climate Ready Tribes. And you can see there's a diverse range geographically, and each of those tribes has a really distinct feel. Our current cohort is Lummi Nation, Palaband, and Sitka Tribe in Alaska. They are wrapping up their projects for this year. And it's really very interesting. Sitka Tribe has a biotesting laboratory so that tribes in Alaska can send shellfish testing data to this lab and get the test results pretty quickly so that they know whether the shellfish is safe to harvest or not. Lummi Nation is working on a similar project. Traditionally, the Lummi people harvested shellfish. It's a traditional food that they eat. Last year, a heat wave coincided with a drought. And so because there were record low tides, the shellfish that they harvest were exposed. And because of the record heat wave, there was basically a baking effect. And the tribe lost about 1 billion clams that they would traditionally harvest. And there are elders in the community who would just go out and harvest those clams. But when when the water becomes too hot, and acidic, the shellfish will actually release a biotoxin. That means it is not safe for people to eat. And so Lummi Nation had to do testing and had to do community awareness around when it was safe to harvest and when it was not. Palaband, also in California, you can see near San Diego, had a wonderful emergency notification system because they are often left out of the county emergency management. And they actually set up that notification system right at the beginning of COVID. And let me tell you, having that in place made COVID response, contact tracing, and vaccine distribution a lot easier. So again, we're thinking about how these projects can amplify each other and how a dollar spent in Indian country can really have ramifications down the line and solve a lot of problems at once. Go ahead to the next slide. So I do want to highlight just a couple previous awardees that are no longer funded by National Indian Health Board, but have been really successful with previous funding. Call Nation in Oklahoma has done, like I said earlier, that community education and outreach, making sure that people, regular community members who don't have master's degrees in environmental engineering, can understand what needs to happen and what are the best ways to protect themselves from either extreme weather events, extreme heat, like we're talking about a lot, and other vector-borne diseases and things like that. Go ahead. The village of Wainwright in Alaska. This is really interesting. As many of you, well, maybe you don't know, the Arctic, Alaska is actually warming much more quickly than the rest of the country. It's about twice the national average. And because the ice is thinning, what'll happen is it'll partially melt and then refreeze. And because of that, people that are, engaging in subsistence activities like hunting are on much more treacherous ground than they used to be. And there are a lot more injuries, right? There's a lot more slippage, there's a lot more snow machine accidents. And because of this funding, they were able to get safety equipment and they were able to notify local emergency response people, hey, my team and I are going to be engaging in subsistence activities, at this general area. If we don't report back in 72 hours, it's time to come looking for us and things like that. They were also able to evaluate the relationship between unseasonable weather and injury using clinical records, which was a very interesting project as well. And then Blackfeet Nation in Montana is in Montana, it's in Glacier County. And it was called that because of the number of glaciers that are present in that community. And those glaciers are receding at a pretty alarming rate. And Blackfeet Nation was able to establish the Climate Health Advisory Team, hired a climate health coordinator, and developed a climate health guide that's available to all of their citizens on their website. So we were very happy to be able to support that work. Now, remember that BRACE framework that I mentioned earlier. Swinomish had a really interesting project around developing Indigenous health indicators. So how do we decide whether an Indigenous community is in a healthy environment or not? We can't just look at the air and say, oh yes, there's X amount of carbon dioxide or methane or whatever in the air. We can't just look at the water and say, oh, there's this amount of chemicals and PFAS located in there. We have to look at things like spiritual health and mental health. And like I said earlier, when Lummi Nation is harvesting their foods, if they can't do that, that's not only cutting them off from an area of food, it's also cutting them off from their traditions. And when we do that, we're impacting a culture's spiritual health when for the past 500 years, European governments and then the American government have worked to destroy those cultures. So, it's something that we have to break this cycle. And so Swinomish did a very interesting study on adapting that BRACE framework to Indigenous health indicators. And you can actually see a webinar, go to the next slide, please, on NIHB's website related to this. And it's fairly difficult to read. So again, this might be something where if you're watching the recording, you might want to pause and take note of this slide, because again, it is kind of hard to read. But community connection and, having communities talking to each other and intra community, so community members intergenerationally, elders teaching youth how to engage in subsistence activities so that knowledge isn't lost, but then also inter-community. So Lummi Nation talking with Swinomish or other tribes in the Washington area and sharing resources and knowledge around that. And then things like cultural use, education, self-determination, and resilience, things that Native people work with and breathe every single day. This framework has been really useful. So I would encourage, again, y'all to check it out. Go ahead to the next slide. And again, like I said, Swinomish created a module with Oregon State University and NIHB to allow other tribal communities, and not just tribes that look like Swinomish, right? They're a coastal tribe and they're relatively small. This is adaptable to everywhere from, Cherokee Nation in Oklahoma to Gila River here in Arizona to the Aroostook Band in Maine. So this you can see the link again, kind of hard to have links when you're in the room here, but if you're watching this recording, that link will have the module right there. And I want to, okay. So that webinar is also available on NIHB's website. I apologize. I thought I had a slide to that effect, but I must have deleted it. So I want to talk a little bit about, and again, this is resources that CDC utilizes in their work around reducing the health impacts of outdoor air pollution. It's something that's more on our minds than it used to be, right? Every summer, it seems like we have to check the air quality before we go outside in a way that when I was a kid, we never really had to do. So there are like airnow.gov and enviroflash.info has air quality alerts that you can sign up for. And the reason those are important, right, is that it'll exposure to harmful air increases the risk of asthma and cardiovascular events. So the recommendations are when the air quality is bad is of course spending more time indoors, and then limiting if you have to be outdoors, do things on a lighter schedule than you would normally do. So if you need to chop wood, chop half the wood you were going to. If you're going for a run, go for a walk, things like that. Go ahead to the next slide. The air quality index, again, is color-based. And this you can check on, again, that link airnow.gov has air quality maps, and you can see how your tribe is the air quality day to day. And they're divided into 6 categories. We want everything to be green, but we're seeing a lot more maroon than we used to be. Go ahead to the next slide. Okay. And then again, coming from Louisiana, this is old hat to me, but we also want to make sure that when tribes are dealing with extreme weather events that are exacerbated by climate change, that if this is not something that the tribe has traditionally had to contend with, we want to make sure that they're able to have the preparations and the adaptations that they need. So again, this was drilled into me when I was growing up in Louisiana, but when you leave your house to evacuate, you have to have a 3-day supply of everything you need. And that especially includes medication and copies of important documents. And that can include medical documents. That can also include, things like, your driver's license and your insurance card if you have private insurance. Go ahead to the next slide. For reducing the health impacts of wildfires, again, having emergency supplies ahead of time is always good. NIHB, actually, I'm getting ahead of myself again because I'm going to be talking about some things that NIHB is going to be offering on the respirator side of things. And you can also go to airnow.gov to keep track of wildfires that are near the community and seeing which direction they're headed and whether evacuation may be called for soon. Go ahead to the next slide. Again, so ways to reduce smoke exposure indoors. Having, staying inside and choosing a clean room where there's no fireplace, ideally there's no windows, and ideally in a perfect world, there would be a portable air purifier to be able to reduce any smog that's present in the room. Go ahead to the next slide. Extreme heat is something that I think is going to be very relevant to Arizona tribes in the Southwest. Tribes are increasingly looking at setting up cooling centers. So that's basically just a public building that has reliable access to electricity and a very good HVAC AC system. So that people can, if they don't have access to electricity or the air conditioning in their homes, they can go and for at least a few hours cool down and either visit with relatives or just sit in the cool air. NIHB did just publish some resources on what to do if your tribe is interested in setting up a cooling center. It doesn't constitute legal advice, of course, but it's just some things to keep to be aware of as your tribe is setting that up. CDC has a heat and health tracker, which I utilize not quite every day, but very frequently. And it is very useful in knowing which areas of the country, including, of course, tribal communities, are going to be impacted by extreme heat events. Again, there's a lot more green on this map than we would see right now. I do encourage folks to utilize that map. Again, the link is on there, so do check back on the slides to be able to click that link. Yeah, and so the heat and health tracker helps inform the following public health actions by identifying extreme heat trends, describing and locating disproportionately impacted populations. So you can see on this map it encircles DeKalb County, Georgia, which is actually where CDC headquarters is based. It's in the Atlanta area. It's majority Black, and it's an underserved community and a population that is disproportionately impacted. It's able to help determine where resources are available and where resources are more needed. And that can be helpful for everyone from community members to folks in the government who are actually responding to heat events. And then again, that can be utilized for local decision makers who are deciding when and where to put their cooling centers. Go ahead to the next slide. All right, so I want to shift a little bit to talk about what National Indian Health Board specifically is doing on this front. I mentioned earlier, we are able to offer air purifiers to tribes that are affected by wildfires. That may be wildfires that are kind of close to home, or what we saw earlier this year was tribes in the Northeast specifically were really impacted by the Canadian wildfires because the wind currents were so strong. We were able to offer up to 60 air purifiers, but because of the overwhelming demand, we are unfortunately having to reduce that to 40 purifiers per tribe. And that can be 40 residential purifiers that you give out to either elders or folks with pulmonary system issues, and it could also be 40 larger building air purifiers for things like schools, gymnasia, tribal administration buildings. We announced this in June, and we had immediately off the bat 6 responses. We've had, I think, on the order of 30 by now. So it's something that obviously there's a lot of demand for, and we are very happy to be able to offer these purifiers to tribes. Again, it is specifically for tribes that are impacted by wildfires. So while I would love to just hand out air purifiers to every tribe in the country, unfortunately, our resources have to go to where it's most urgently needed. So if you are a tribe that is impacted, please do go to nhb.org/air purifiers. So I want to talk a little bit more about how NHB's work with the Environmental Protection Agency is building out. EPA, like any federal agency, has the aspiration of maintaining a government-to-government relationship with tribes, and it collaborates with tribes and other indigenous peoples, which is to say Native Hawaiians, who are not a federally recognized tribe, but still have a colonial experience with the United States government. The EPA tries to incorporate traditional ecological knowledge into the work that it does, and provides advice and recommendations to tribally run environmental protection departments. And that is very importantly worded because they're not telling the tribes what to do. They are saying, hey, in our experience, we have found this to be successful. You have a similar circumstance. It might be good for you to try this out. It's kind of a partnership, and it's something that that is the nation-to-nation relationship. That's the aspiration, right? And so it's the work of organizations like National Indian Health Board to keep them at their word and make sure that they're doing those activities that they need to be doing through their National Tribal Caucus, which for those of you that work in the Department of Health and Human Services, that is the equivalent of STAC, which is the Secretary's Tribal Advisory Committee that tribal leaders sit on to advise the Secretary, or in this case, the EPA Administrator, on issues impacting Indian country. They also have a consultation policy and the very interesting tribal treatment as state model. So obviously our Constitution gives a large amount of governing authority to state governments, and EPA will, for tribes that apply and demonstrate their ability to utilize this model, EPA will treat those tribes as the 51st, the 52nd, the 53rd state. There are 107 tribal programs treated as states. That doesn't mean 107 tribes. That means 107 tribal programs, because some tribes have more than one program under this, and then some programs serve more than one tribe. Most of these are water sanitation. So having those programs being treated as states allows for more funding to go out the door to Indian country. So we did get a grant from EPA recently. It's $10 million over the next 5 years. It's overseen by the Environmental Health Programs Department, which is my department. And you can see NIHB, this is our team. This is the public health team, which environmental health is about a third of that. So we have about 6 people. And we're building out more people. So if you know anyone who wants to come work in DC, please send them my way. Go ahead to the next slide. So the project that we're working on is called the Thriving Communities Technical Assistance Center. Now, I say with love and affection for our friends at the EPA, they abbreviate this as TICTAC, and I'm just going to call it the Technical Assistance Center. So the center is designed to assist underserved communities who are both disproportionately impacted by environmental health concerns, which we've just spent 20 minutes talking about how tribes are, and who are underserved by current EPA and other environmental health programs from the federal government. The word underserved should always make your ears perk up because tribes are absolutely underserved. This perfectly describes Indian country, and the Technical Assistance Center is going to make a very big difference in Indian country. And we're really excited that EPA was so enthusiastic about ensuring tribes were at the table. So there's a network of technical assistance centers, and you heard from our friends at the University of Arizona earlier. They'll be serving tribes in this EPA region, and they'll be serving tribes and non-tribal entities in this region, and we'll be serving tribes nationwide. So we'll work very closely with that network. And this was funded by the Infrastructure Law and Inflation Reduction Act that Congress passed last in 2022. And frankly, Congress has putting quite a bit of pressure on EPA because they did allocate quite a good chunk of change that they want to get into communities as soon as possible for things like lead abatement, for mine reclamation, brownfield reclamation, water sanitation. All of that money is coming down the pipeline very soon. And there's a lot of pressure from Congress to ensure that EPA is getting that money where it's most needed. And that's where they're going to be relying on us. So there's 3 national technical assistance centers awarded. National Indian Health Board, of course, will be serving tribes. And then there's the Institute for Sustainable Communities and the International City County Management Association, or ICMA. There are 13 regional TACs awarded. I am not going to read all of them, but if you're familiar with the EPA regions, regions 7, 8, 9, and 10 tend to be where the most governments are. So we'll be working especially with the regional centers in those areas, particularly like New Mexico State, Wichita State, University of Arizona, San Diego State, Willamette Partnership, and the University of Washington. So here's a map of those EPA regions if you're not familiar with that. Like I said, will be the national TAC for tribal applicants, potential applicants, and advisees. So how that's going to work is we're going to have basically a database on our website that has tribal environmental health funding programs for which tribes are eligible. And a tribe can do one of 2 things. They can either say, hey, we want to apply for this grant. Can you help us write the grant? And we won't actually write the grant, but we provide unbiased technical assistance. So, we'll help them through the process. We can certainly review what they write. We can do everything except write the actual grant for them. A tribe could also say, hey, we have like a tribe in Alaska can say, hey, our washateria broke down. We don't have running water in our community. We need a federal grant to bring running water, create a running water system. And then it's on NIHB to find the federal opportunity, connect that tribe with them, determine if it's a good path forward, and then help them with that application. So a tribe may see this and say, oh, our grant writing department isn't robust enough to really even go after specific grants. Don't worry about that. Just come to us with your problem and we will help solve it. And then we will work with those regional TACs, those 13 organizations, to make sure that tribes are always included. So just because you're, working in, New York State doesn't mean that you can ignore Seneca Nation in all of those tribes in upstate. We always want to make sure that tribes are included. And then also there's non-duplication, right? If we're serving a tribe, then we don't want to the other regional TACs to waste their time also serving that tribe and vice versa. So that does require a little bit of coordination on our end, but that's something that we're working on now. Like I said, we'll have that portal, which has a database on funding opportunities on NIHB's website. I'm looking at Ned because it's actually his job to build it out. Yay, Ned. Thank you, Ned. We'll be providing one-on-one technical assistance, and we'll do trainings and briefings throughout Indian country, right? It's one thing for us to be able to do it by and for the by, with, and for the tribe. It's another thing for us to be able to stand up a tribe to be able to do it themselves. That all of that work is launching later in 2023. So don't look for it right now, but it'll be coming relatively soon. Additional projects that we'll be doing with this work under the EPA is trainings on environmental health opportunities that are using federal funds and also non-federal funds. So if the state of South Dakota decides, hey, we want to have some environmental health funding go to our tribes, sure, awesome, I'll take it. And we'll work to make sure that that money is getting to the tribal communities that need it. We'll also be doing an in-depth guide for EPA activities in Indian country. So when EPA is working on plugging up some abandoned uranium mines in Navajo Nation, we certainly want to highlight and elevate that work and say, all right, awesome, you did 80. There's what, 521 left to go. So okay, let's keep going. We'll do policy analysis for EPA and other agencies impacting environmental health. For those of you familiar with National Indian Health Board, policy analysis is kind of our bread and butter. We have a very robust policy team that traditionally works with HHS, IHS, CMS, and all those wonderful acronym agencies that are working on health. But environmental health is a bit broader than that, right? We wouldn't necessarily think that the Department of Transportation has a lot to say about health, but it certainly does when we talk about standards related to how much pollution that our heavy trucks can utilize. And it certainly does when tribes are setting up electric bus fleets to replace, bus fleets that have been in existence, that have been operating since, the 70s or 80s and are reaching the end of their lifespan. So so having those agencies kind of at the table is something that we want to make sure is occurring every step of this way. We will also be doing a capacity scan of Indian country's environmental health professionals. Like many of you know, sometimes in Indian country, the people that work on environmental health are the health people, and they need to be trained on how the environment impacts health. But then sometimes the environmental health people are the emergency management people who, are working on things like a hurricane, and they need to make sure that they're evacuating people and putting them in a gym that is able to avoid a COVID outbreak afterwards. And then sometimes it's also the natural resource people who don't know, who don't have the training around health because they're more like natural resource inclined. So having those skill sets in one department, or in some cases, in some tribes, one person, can be very, very demanding. And so we want to make sure that we want to get a lay of the land through this capacity scan, and then we want to tailor our resources for where things are most missing. We want to create those materials to expand skill sets and build capacity. We will also be funding tribes. This will be 2024, 2025, funding tribes to plan transition to carbon neutral energy and electric vehicles, right? Navajo Nation used to have a coal plant. And when the coal plant closed, there were certainly environmental health benefits to that, but a bunch of people were out of work. And so having the tribe be able to plan for a transition that doesn't leave anyone behind and still ensures access to clean air and clean water is something that NIHB and EPA want to support as much as possible. The other two activities we'll be doing to, again, expand those skill sets and expose more people to tribal environmental health, we're going to create an internship that'll be open to undergraduate students and graduate students. It'll be, obviously for Native students that are interested in this area and who are wanting to get exposed to how DC works and take those skill sets and go change the world back home after their internship is done. We will also be doing, for the first time that anyone at NIHB can remember, and I've been there for 7 years. Our CEO has been there for, I think, 17. So she is not aware of us ever doing this. So I'm really excited to be able to do this. We're going to be doing some language translation. So we all speak the language of the colonizer, right? Our traditional languages sometimes have been lost. Sometimes there are a limited number of elders who are kind of the last hope of the language. And then some have very vibrant language communities that are really self-sustaining, and the youth are being able to learn their language in a really wonderful way. But we're going to be able to utilize some of this funding to translate some of our materials, the stuff that's more community facing, into Indigenous languages. So we're going to start with the bigger languages, probably Diné, which is spoken by, I think, 200,000 people, and then Cherokee, which they're also a large tribe. with a robust language department. And then we'll branch out to UPIC in Alaska and other languages that we'll be able to utilize. Go ahead to the next slide. So Arizona tribes, the next steps for you on this front are, like I said earlier, tell us what environmental health projects you need federal grants to support, right? If there's federal money for closing or remediating mines, absolutely, we will work with you to get that money to your community. If you're needing to build out a water sanitation project, okay, let us know and we will search for those dollars as much as we can. Once that portal launches, once Ned finishes up with it, please use it. Also, like I just said, with those language translation, connect us with those community members, especially on Navajo Nation. There are many people that will do translation services in Diné. So we want to be connected with those folks and make sure that these resources are translated in a really good way for the community that doesn't necessarily speak the colonizer's language. And then also, we are a DC-based organization. I love Washington, DC, and I'm often in the minority when I say that. But if you know anyone who wants to come change the world with us in DC, please send them to us, because I'm hiring for a whole bunch of environmental health professionals. And I am really looking forward to having a really robust team. My team now is wonderful. We're small but mighty, and I want to double our size. So very ambitious. And I think that is it. Yeah. So go ahead and jot down my email or anything. And I think we have I don't know how I'm doing on time, but I can certainly take a few questions before we head off to our next presenter.
Brett, will you go back to the slide that's additional capacity, please? One of the things that you indicated on the top right is a capacity scan, and then underneath that, expand skill sets and increase capacity, right? So
Yeah.
if the tech folks will go back to that slide titled additional capacity, can you tell us a bit more, if you will,
Yeah,
right there, top right? What is your thought about a capacity scan of Indian country's environmental health professionals in relationship to what Captain Ritter was talking about for the need for water sanitation, whether it's certificates or et cetera? So how do you imagine that our water and sanitation fits within this particular framework of environmental health, given, and I agree with you completely, that it's a very much larger umbrella that houses so many different things underneath that umbrella. Thanks, Brett.
Yeah, thank you so much, Dr. Welch. So with water specifically, what we see, and I think Troy would back me up here, is retention is a really pressing issue. So a tribe will hire someone and, okay, you're my water guy, so you're going to work on water sanitation. And then that person has a large number of skill sets. And so particularly if they are not a member of the tribe, they may find that working in the suburbs is more appealing for their family. And so after a little bit of time, they'll either, if they're being overworked, they might feel burnout, or they may just, want to go back to the suburbs or something like that. And the tribe is back at square one. All right. So what we want to do ideally with this capacity scan is kind of get the lay of the land, like I said, around what skill sets are missing from tribal environmental health departments. And, I don't necessarily know the answer to that off the top of my head. There are a couple of things that I expect. I do expect retention to be one of the issues. I do expect, like you said, the high cost of certification. A tribe can't necessarily afford to send someone to a conference for $1,000. One, because they can't afford the $1,000, and two, because they can't afford to be without that person for 4 days. And so there might be, capacity issues around that. And so with water specifically, we would want to see what kind of skill sets and what kind of certifications are missing from the tribal community's workforce. And, potentially, and EPA and I have kind of talked about this a little bit, we want to be able to put NIHB in a place where if a tribe needs to train someone, the tribe is not going to be negatively impacted by that. Whether that's EPA setting up stuff for free, whether that's NIHB paying for the tribe, we haven't really gotten there yet, but that's kind of the goal, where the tribe is kind of held harmless there.
I'm wondering how we might be able to do like what I'll call a quad, like a four-legged chair between NIHB, CDC, NCEH, ASTDR, and EPA, where, you know, we have a workforce pipeline, much
Yeah.
like a EIS officer,
Mhm.
right? 2-year cohort. Why not start one for water and sanitation, right? So that we
Yeah,
have a
that's a good idea.
pipeline and put them into the field with IHS area offices, tribal partners, CDC, and then we can provide the curriculum, the training in our partnerships, and multiple partnerships, including NIHB, University of Arizona, University of Washington, so forth and so on, to get those trainings and to grow our own, right? So
Yeah.
it's this 6-year pilot, if you will, because each cohort would be 2 years long. When the first cohort of, say, 10 people or 12, because there's 12 areas, IHS
Yeah,
areas,
IHS.
right? That when cohort 1 begins their second year, then cohort 2 starts their first year.
Yeah.
So then it goes for 6 years. So we get a rotation of 3 cohorts. But in theory, it's at least 40 more people into the pipeline.
Yeah.
With field experience, with mentors and certifications. So that might be a place to start. We might even be able to expand that number depending upon how we come up with how do we support the tribe
Yeah.
or the individual in terms of some sort of economic income so that they can go through this experience. Are there other questions? I can pass the mic.
And while you're passing that mic, Shay, I really liked that idea. And you, me, and NIHB CEO Stacy Boland should sit down soon and talk about that.
Hello.
ahead.
That'd be awesome if you guys could set that up. My question is, and forgive me if I'm not aware of this, but you mentioned at the beginning that there was a climate emergency. Did I hear that wrong? Yeah. I don't know if this is something that's recent from the Biden administration.
Oh.
Is it?
Do you? Oh, okay, yeah. No, so the President Biden today announced that an area around the Grand Canyon, about 900,000 acres or so, is going to be a national monument. And Congress, I think I want to say like 1906, Congress passed a law called the Antiquities Act that the president can just unilaterally declare an area to be a national monument because it's either culturally or it's important to the American people that it not be developed. And obviously the Grand Canyon has a lot of aesthetic value. There's also quite a bit of ecological sensitivity in that area. And then also, of course, the tribal communities rely on that area. There's actually a tribe inside the Grand Canyon, for those of you that are not from Arizona, excuse me. So what the president designated today is that area is a national monument. So basically, there were some uranium mining companies that wanted to mine in that area. There was a moratorium from the Obama administration that I think was set to expire, and now it's a monument in perpetuity. So yeah, that's what the announcement was about today.
Okay. Did you mention anything about a climate emergency?
So President Biden has, I don't think he's called it a climate emergency, but he has said that climate change is a significant priority for the administration, and they are taking an all of government approach. So, it's not just EPA's problem, it's HHS's problem too, and Department of Transportation and the State Department. They all have a role to play in climate change. And so his administration is really putting our federal partners, who I love and adore, their feet to the fire to work on this issue. I think that's what you're thinking of.
Yeah. Okay. I was really confused. I was
Oh,
like,
I'm sorry.
I don't think I was like, I was Googling it. I was like, I don't think there's been an emergency yet.
And I think she had a question as well in the back. Yeah. And I think time-wise, that's my last question, and then we have to move on. But I'm going to be here. So if you have anything else that pops to mind, just come over I'll be sitting right next to Dr. Welsh.
Not so much question, but just to add to the Can you go back a slide? The, I'm Tammy Balone with 8 Northern Indian Public Council. You want to do see what tribes are doing in terms
Yeah.
of environmental health professionals?
One more slide, yeah. Yeah, the capacity scan.
Yes, that. I like that idea. And you mentioned, several reasons why, look at the room. There's not a whole lot of people here.
Yeah.
Why are they not here? And for me, I may have felt a little intimidated because I'm not in the environmental health field per se. I have been doing environmental protection work for a long time. In fact, I used to work for Navajo EPA. So I like this idea because I think it's forgotten and maybe federal agencies don't know that a lot of tribal folks wear many hats.
Yep.
I used to work for one of the pueblos in New Mexico, and I was, wearing 20 hats. And also that tribes have different objectives or priorities year in and year out. And maybe what, the uranium mines may not be a priority per se, but it should be every year. But nevertheless, because of COVID, maybe their focus is more on COVID, post-COVID, what have you. So I think this is a good idea. And I think it'd be, I would love to keep work, keep in touch about this. But, the priorities change. It's very common for tribal folks to be just, doing 20 things and getting paid to do 3.
Yeah.
And that's where, retention comes in. So I like this idea. I think it's great. But I also like Shay's idea as well, because what we're seeing is a lot of job vacancies. What are the younger folks doing? What are they studying? Is it all about computers? Is it all about gaming? Where are they going? Why can't I find young professionals, native professionals to fill these jobs? I from my office, I get, maybe monthly at least job. Hey, can you share this? Absolutely. I'm sharing it. I'm sharing it, as far and wide as I can, but what are the younger students doing? What fields are they going into? So I like that idea, Shay.
Yeah, thank you so much. Yeah, definitely. Right, and I think I'm handing it off to our next presenter, right? Okay. Shonda, did you want to introduce them? Okay. All right.
Hello and good afternoon. So I don't have any slides today, so I'm just going to talk a little bit about who I am and what we do. So my name is Jennifer Botsford. I am the Bureau Chief for the Bureau of Environmental Health Services at the Arizona Department of Health Services. So we have some of the programs that you heard about today from CDC, from ATSDR, and I was just going to talk to you a little bit about how we've implemented those programs and mention some of the times we've worked with tribes over the years. So I know we've talked a lot about climate, so I'm going to start there. We are in the middle of a heat wave again. We just came off a record-breaking heat wave of 31 consecutive days over 110 degrees in the Phoenix area. And it has really stressed our communities and the resiliency to be able to respond to that. So I wanted to talk a little bit about how we mobilized some of our work and how the prep work really helped us respond in a good way. So we have the BRACE grant from CDC, and that started many years ago, and they did the climate adaptation plan. They did the analysis of the hazards. What would we be most worried about in, sorry, there's a mosquito. What would we be most worried about in Arizona? And so we identified heat, wildfires, smoke, vector-borne diseases, and we really wanted to focus on heat-based and put our resources there first. So we created toolkits for schools, for outdoor workers, and for elderly, because we learned that those are some of our most vulnerable populations. And in that, we have also learned that vulnerable populations include our populations that are houseless. And we have developed so many partners over the years as well. So we have worked with our counties, our cities, universities, other state agencies, anybody really that wants to participate with us. And so we have an annual heat meeting, and we had over 200 participants this year. And we talk about how our organizations can work together, what the priorities are for those organizations. 6 tribes did participate this year. So we hope to see all of you in the future if that's a concern for you. So in this event, this heat event right now, the governor's office put forth some money to support community centers, heat relief cooling centers. Our heat relief network focuses on more than just cooling centers. So we want to make sure that people have access to water while they're there, that they can cool, they have a space that's comfortable for them. They can come in, they can cool down, they can get some water. There are some centers that will actually allow you to bring pets. So we want to understand barriers to why people may or may not go to a cooling center, so we can work with the partners to find ways to reduce those barriers. Transportation may be a barrier. So if you're living in the Phoenix area, you can contact 211, and they will hook you up with a free ride to a cooling center. So these are some of the resources that become identified in these heat meetings. And then we have a resource that we post on our website. We work with our social media team. We put out blogs, social media posts. We update our website. And we also have our heat warnings are posted on our website. So the ADHS.gov website has a heat warning banner at the top of every single page. So anybody for any reason that's coming to the ADHS website will be made aware that there is a heat warning. We have 2 listservs. One is targeted for school nurses and one is for anyone else. And so with the school nurses, we provide some guidance on that there's a heat warning, and some ideas, I think, on what they can do with the children instead of like going outside for recess. We have a data dashboard. So this is something that we built over the years and in coordination with some of the funds that we got from the Environmental Public Health Tracking Grant. And that is a program where we take environmental data and health data and put it in the same place. So you can look at maps and trends and things of that nature to get more information about how health and environment kind of interact. We also work with our director at the agency to put forth blogs, so that can reach some of our public health leaders in the state on what we're doing around heat or any other health topic that she writes about. I wanted to talk a little bit about our cooling centers as well. So when an individual goes to a cooling center, they are open during business hours. And so, as you know, during this last heat wave, there were many nights that didn't go below 90 degrees, and our bodies need to cool off at night in order to recover to withstand the next day of heat. And so when these cooling centers aren't open overnight, it can be harmful. It's not harmful. It's just not as helpful as it could be if we had some that are open overnight. So we have been working with one of our partners to offer an overnight cooling center, and that's only in Phoenix, and that's only one of them. And we know that distance to a cooling center, it really matters. And so that's something that we're starting to talk about as well. Like, how can we extend those hours a little bit longer? And what would it take to make it an overnight center? Because, there's a lot that goes into that. Also, talking about overlapping health issues, if we're looking at our populations that are served by the cooling centers, sometimes they are the unhoused and they come in and whatever state they're in, right? And so if they've been using drugs recently or anything like that, and they come in, they have a medical emergency, we are working with partners to put Noxolone in those cooling centers so they have access to some medical treatment as well. And so working with partners to understand the population they're serving and all of the needs, not just they need a bottle of water, but what are all their needs, so we can work with our partners and see how we can address those. We are working with organizations to accept donations for bottled water to make sure that it's easy to pass out a bottled water to people that come in. So let's see, what else have we done in regards to heat? We have a related program called Sunwise. It is funded by the CDC block grant, and our coordinator will go out and give presentations to pretty much anybody that wants it, but she focuses mainly on workers, outdoor workers and schools to educate around sun safe practices, and we're incorporating heat messaging into those presentations as well. So she has spoken for Parks and Rec. She has done Train the Trainers. And if you are interested in that, just contact us. You can go to azhealth.gov/heat. You can find our contact information there. And we can set you up with that service if that's of interest to you. Let's see. We also have so in the climate program, we also work with our universities. So our universities are doing a lot of the climate work and understanding the climate science and giving us some of that data to work with to help with our projections and our strategic planning of where we want to focus on in the future. I wanted to take a moment also to talk about some of the other programs we have from CDC. So I mentioned the Environmental Public Health Tracking Program. And so that is a dashboard that provides the heat-related illness in somewhat real time. So I think there's a 2-week lag, but we have information in real-time data as to how many illnesses are happening in each county over time. We also have well water data on that. We have some cancer data, I believe. So there's a lot of different data that you can go and just kind of explore it. Let's see, what else do we have? So our ATSDR program, I want us to speak about that again. So that is where I started. We call it Environmental Toxicology Program. It's a program that's funded by the Agency for Toxic Substances and Disease Registry. And we employ a risk assessor, a toxicologist who does risk assessment, and a health educator. And that program will work with EPA or DEQ in local communities to try to answer local communities' questions about these sites and how it might be harming their health. So we know there's TCE in the groundwater. Is that harming me? So that's the question we'll dive into. So we go and we gather the data and we assess, okay, are people being exposed to that water at what level? And is there an immediate health concern, a long-term health concern? And we communicate those results back to the community, hopefully in a way that they understand, and give them tools to reduce exposures if that's needed as well. And years ago, when I was in that program, I actually was working with an individual from Gila River Indian community who also was funded in the same program, and they were brand new and I'd been in it for a little while. So we worked together to share experiences, to review documents, to provide that level of co-working support. So obviously they had support from ATSDR as well, but you know, it's nice to have somebody local that you can talk to as well. So we worked together on that on a couple of projects until she was more familiar with the process and she was more working on her own. We have a tribal liaison as well. She is really great at putting us in contact with people. So a couple of examples came up. We have a childhood lead poisoning prevention program. We get all of the lead data. Every person that's tested for lead in Arizona, those lab results come to us. And if we find an individual who has an elevated blood lead level, we like to go and do case management. So we can offer education to the family on how to reduce lead exposures. And we can also offer to go into the home and try to help them find the lead source. And so there was a family who was on tribal land who wanted those services. And so we went through the tribal liaison to go and talk to the tribe and make sure that this was an activity that everybody was okay with. And we were able to go and provide that service to them. We also had a request from an individual who wanted their well water tested, and that's in the works. We're in the process of getting all the right approvals on that, so we can offer free well water testing to that individual who requested the service. We also have another program that is funded by EPA called the WIN program, and it provides funding to do water testing in schools for lead and childcare centers and Head Start, I believe. So we have a system in place. We have a contract with a contractor who will go out and do the work. Our state lab does all the samples. So we created all the documents around that. How do you collect the sample? Flyers about why a school might want to participate. How do we find resources for them? If there is an elevated lead, how do we address it? All of that documentation, the QA, QC, to make sure that the data that we get was done well and we can trust it. And the Intertribal Council of Arizona contacted us to just talk through how we run our program and how we've implemented it and what we've seen today, that sort of thing. And so we spent some time talking to him. He was very grateful for the conversation. He said he took 4 pages of notes, but we also shared all of our documentation with him. So it's, you know, if you guys have a similar program that you're trying to start up, if you have, you know, questions, resources that you kind of want to just talk through with another partner who's kind of done that before, we're here and we will share whatever we have. So whether it's just having a conversation, sharing actual resources, we're available for that as well. Another thing I wanted to mention that I noticed my boss will be starting. He is the assistant director for preparedness at the Department of Health Services. He's, I saw on his calendar that he has a first tribal health directors meeting. And so I think it's going to operate a little bit like our county health officers meetings where they meet quarterly and they just talk about health issues in the state. And so I think that's a really great opportunity to kind of learn more about our agencies and what's going on, what's important in our communities, and how we might be able to share resources moving forward as well. So that's all I have on my notes on what to talk to you about today. I don't know if you guys have any questions or anything you want me to talk more about.
Jennifer, thank you so much. That was absolutely fabulous. And what is one of the most incredible things is when we have programs we're willing to share. We're willing to help others and say, here's how we did it. And then we learned this part didn't work. So don't make that mistake. And this is what we did to pivot, to put it in place. The other incredible thing about your team, your work, and it's somewhat unique to Arizona, is that you work hand in hand with the tribes. They are true partners. We have states around the country that would rather not have tribes exist. And you are the opposite in the pendulum swing. So thank you for that. That doesn't come easy. That's an additional effort, a mindful effort to reach out and always think about the indigenous peoples of this land. So that is so worthy and so honorable. So thank you very much for that. The other thing I think that is very impressionable is how many different resources you have pulled together in order to make maybe not a comprehensive, because there's still gaps, there's always going to be gaps, but really impressive on how you have leveraged your partnerships, your funding, and you've diversified your funding. You must have some like, I think one of the presenters earlier was talking about, we call it SPIES. Remember that when he was talking about that from the Poison Control Center, he was talking about their program is called SPIES. You must have SPIES out there on what funding is coming up. So good job. Absolutely incredible. Round of applause for the good job. Yay! Woo!
Thank you.
Any questions for Jennifer? Oh, here we go. And thank you again.
Thank you.
Hello.
Hi.
What is the information that you mentioned about your boss having like?
Oh, there's just a new meeting. I just saw on his calendar. I don't really know much about it. I won't be in that meeting, but it's a tribal health directors meeting. And so
Okay.
I imagine it's going to be similar to the county health directors, where each county has a health director for that county, and they get together on a cadence like quarterly to talk about issues that are going on in the communities that they serve. So talking about resources that could be shared, needs that are there, technical assistance, anything that comes up, it gets discussed. And so I imagine that's what this is going to be about. And I hope it's the first of many to come where we can improve, well, just increase that reach, you know, just know what the asks are out there and how we might be able to work together.
Okay, I have another question. I don't want to be too invasive, but
No problem.
is your boss still in the environmental sector, or is
No.
he overall?
He's over preparedness, and preparedness includes HIV, TB, infectious disease, emergency preparedness. So, yeah.
Okay, that answers my question. Yes.
You hear me?
Yes.
Thank you so much. Really appreciate that. As Shay said, it was a great presentation. Thank you too, Brett, for your portion. I think that brings us to the end of the day. Are we prepared to take any last minute questions? We have a half day ahead of us tomorrow, but there may be some lingering questions that folks didn't get in. Yeah, I'm looking around the room. And I'm passing it over to Brett because I see no questions.
All right. Thanks, Sharonda. For those of you that didn't get a chance to pick up one of our Active Love kits this morning, please do get one at the sign-in table. These are part of NIHB's COVID response, thanks to our friends at CDC for the funding. But our Active Love kits include some COVID-friendly materials like a hand sanitizer, a mask, and things like that. So please do take one on your way out.
Okay, last words then. Ned's gonna do some interviews, right? Because as you said, we wear so many hats. And it might seem like, oh, an environmental health summit, that's not really in my lane of work. But everything we do is connected to the environment. And the environment is connected to everything we do. So please, 30-second video, Ned right here. There's Ned. Whether you work for the state, whether you work for whomever, talk to Ned. Ned's my guy. I'm going to see those videos tomorrow. So with that, any last thing? Join me in standing and giving Creator thanks for the day. I want to thank the AV